Welcome back to the channel. It's Dr. Durst, and I have my co-host with me today.
Hey guys, Faraday Goli, nurse practitioner here at RevitalyzeMD. And today we're going to talk about the best natural hair supplement out there.
Yes, I mean, it is one that we sell frequently, and it has lots of secret ingredients in, but we're not going to hold off any longer. It's Nutrafol. So if you have not heard of Nutrafol, it is the one that we find to be the most successful at growing hair or assisting us with our hair thinning treatments in the office. So Nutrafol is a supplement that you can get over the counter, and you can purchase it from, regenerative offices or aesthetic offices as well, especially if they're doing hair thinning. It's a top hair growth supplement, and it has lots of different ingredients, lots of secret ingredients in it. So,
And we're going to break down some of those ingredients and talk about what they do and why they work. But we do see Nutrafol consistently benefit our patients. So much so that we've actually incorporated it into a lot of our hair regrowth packages.
mhm.
So we are a big supporter of this supplement because it works.
And we don't have any affiliation with Nutrafol, so we do feel very strongly about it. So basically, one of the ingredients is ashwagandha, and so that is a herbal adaptogen, and so it has lots of positive effects. And so if we're talking about that from adrenal support, it's really just kind of supporting tissue where it is, and so definitely is good at combating stress-induced hair loss, which is not an uncommon thing
Yep.
because major life stressors happen, and hair loss is definitely one of those things that happens along with it. So,
Another one is saw palmetto. So I think that one is one that you hear often. It's
mhm.
maybe one of the more common supplements out there. It is a DHT reducer. So that's dihydrotestosterone. That's a metabolite of testosterone. So it will help reduce DHT, which can build up into the hair follicle and cause that follicle to shut and push the hair out and lead to more shedding. So it does reduce the DHT levels.
Testosterone, for instance, will convert to like a DHT, which is the dihydrotestosterone. And so it's that 5-alpha reductase that it's inhibiting, but it's a natural supplement in doing so
Mhm.
because otherwise you have other things that you'll hear, such as like propecia. And that would be if an oral form, I wouldn't recommend that you just go randomly take that. So I think this is a natural way to block DHT production.
Absolutely.
So,
And it's also known for prostate health as well for the same
mhm.
reason. It blocks DHT, it helps reduce that level. So it is beneficial for prostate too for the gentleman out there.
Yes, it hits both of
It's a
those. And then
twofer.
it's a twofer. And if you're going to do a DHT blocker, you definitely want to do it in a saw palmetto if you're doing it orally. And otherwise, you want to do that topically. And so, just a marine collagen structural protein. So, like they're always proprietary ingredients, and but basically, you're looking at omega 3s, which are going to provide structural support and elasticity, and so support of the hair follicle on the scalp. And so that is another one, and it's always in hair supplements, but it's again a proprietary blend of that for each supplement.
Yeah, and that's looking to really strengthen the hair shaft.
Mhm.
So definitely helps give the hair what it needs to be stronger
Yeah,
so that we
yeah,
don't have breakage, which we do see often with dry hair.
breakage, and then you also have just thinning of the hair follicle itself, and so just thinner, unhealthier hair. So biotin's in almost every supplement, a B7, and so hair supplements always have that. But D and E are something that aren't always, and I will say that we optimize vitamin D and follow vitamin D levels in our patients, and I've had a couple that have went up kind of surprisingly. And then we backtracked and realized that it has 2,500 IUs or international units of vitamin D in it. So you're going to get some boost in that vitamin D when you're taking Nutrafol, which is good because some people don't take vitamin D like they should. And so that actually gives you that boost of daily vitamin D as well.
Which
So,
we all need.
mm,
Everybody is low. It's very
mhm.
rare for us to see somebody who is not low on vitamin D that's not already supplementing at a pretty high dosage.
Yeah.
And then, like Dr. Durst said, there's vitamin E. So that helps hair density. So that's going to reduce oxidative stress within the hair shaft itself and the follicle.
And then curcumin or turmeric is another one, which is an anti-inflammatory, so helps again with any inflammation that you might have. And then hyaluronic acid.
Yeah. Hydration of the scalp.
Mm-hmm.
One molecule of hyaluronic acid can bring up to 100 molecules of water. So it's extremely hydrophilic. It loves water.
Yeah, and so you definitely want a healthy environment in your scalp, and that is one way to get it. And so that is a good one to think of. And if you think about how many different like products we put on our hair, and so we'll clean our face a lot better, but at night we're not cleaning our hair follicle. And so we do something, and almost there's lots of offices that you can find that do this, that stimulates some hair growth in addition to a supplement, is like a hydrofacial, where we actually use a machine that can also do it in the scalp. So instead of taking a machine, and it's a facial, but if you think about a facial with a machine, it's 2025. We've been doing it for more than 5 years, but it still ends up, well, since 2017. And so, but it sucks all the dirt out of the scalp, and then that stimulates the hair follicle as well. And so we don't do that to our hair every night or even every
I don't
day.
wash my
Yeah.
hair every night. I know most of the women out there do not. I don't know if men wash their hair more frequently or not, but I know many women only will wash their hair a couple times a week if they can get away with it. So just think of all the stuff we're putting in day after day and how that can build up on the surface of our scalp and prevent hair growth.
Yeah. And so there are some good studies too that will, so again, any kind of a comprehensive is how we address things. And so we have lots of other videos talking about what we'll do, from PRP injections and microneedling on the scalp when we're doing this. But basically, we want to hit it from multiple different angles and check the hormones and make sure everything looks good with your hormonal picture and your thyroid. But there are studies that show that Nutrafol supplementation works for women with thinning hair. And we hear that in the office on a daily basis. So sometimes we can see studies, and then it doesn't pan out in practice, but it does. And so everyone is happy with Nutrafol, and it's something that we don't have an issue with as far as selling.
So I think it's really important clinically to remember that anything you start, especially when it comes to hair regrowth, it's going to take a good 3 to 6 months to see improvement. So hair grows typically in 3-month cycles. So when you're taking Nutrafol, this isn't something that you can take for a month and go, oh, it didn't help. So you really need to stick with it. For us, we encourage our patients to do a 3-month package of Nutrafol so that we know that they're getting all the supplements they need, so that they're doing treatment for the full time frame they need to be doing it. And that's just something that we hadn't mentioned yet. So at least 3 months to start seeing a benefit from the supplement. So you do have to make that commitment.
Yeah, so it's not a quick fix, and hair is not a quick fix.
Not much in life is a quick fix.
No. There's no one and done. It takes a commitment over time. So just making sure that you take that every day. And then it is something that they say that postpartum, women can take, and it's safe with that too. So just things to think about. But again, hitting that from multiple angles, but nutrients to the hair follicle is key. And so definitely look into Nutrafol, and we'll put a link below in the description. So let us know if there's any other questions, anything that you have used, so that we can learn from you. And then also deep dive into anything that you might want to talk about. So share, like, subscribe, and just let us know, because we are willing to deep dive into anything. Thank you.